Um, yeah, yeah, yeah. So all the herbs, and the herbs shall be for the healing of the nation. Yeah. This one was given to Christ in the scriptures, you know? Yeah. This one helped the woman to lose weight. And we give this to people who have what we call water cancer or lymphoma. Yeah. Pennyroyal is part of the Lamasi family, and we use this herb for women who having trouble in their menstrual, but it have a lot of alkaloids, so we have to be very careful using this plant. This plant over here called pork root, we give it to people or women who have, hi Sophie, we give it to women who have breast cancer, and they have the lumps in the breast, and we put this into a powder, and we mix it with some golden seal powder and some frankincense powder and some periwinkle, and it helps to move the lump out of the woman's breast. If this herb right here, pork root they call it, it helps to remove the lump from the woman's breast, and she see the lump. This herb put a very small hole in the woman's breast, and the lump comes out if it's cancerous. So instead of having that lump in the breast, this herb will help to remove the lump in the breast by putting a hole in the woman's breast, and the lump comes out, right? This herb is called meadow sweet or queen of the meadow. And this herb is very significant for people who have acid, what we call hyperchlorhydria, because it drop acid. You know what I mean? So this is very important for people who have hyperchlorhydria. But if you want to drop the acid, you have to mix this herb with another herb called orange peel or some turmeric to mix it called dopa. So when this herb drop the acid, you don't drop too much. You don't get you'll be able to put in your protein foods. Okay. This one is called licorice, and you know what licorice does. Licorice is a sweet herb, and this herb is very significant for the stomach and for the lung. But it acts as what we call an adaptogen, meaning that it helps you to adapt to the stressful environment that you're living in. Now, this herb, although it is very significant, it also can make you retain sodium. So if you have high blood pressure, you have to be very careful using licorice because it makes you retain sodium, which can raise your pressure. But if you can mix it with other plants, it will cut down on that side effect of increasing sodium into the system. Okay, don't forget. This one here is called lobelia, and this is what we call an antispasmodic plant. We use that plant for people who have asthma, you know, people who have troubles in the brain with epilepsy. We mix it with a herb called black haw, and it's very significant for people who have any kind of trouble in the lung, and this is how they have spasming. We go again, we give you another one again before we start the program. Shepherd's purse. This herb is significant for when you have nosebleeds, gum bleeds, when you have bleeding from the rectum, when you have menorrhagia, women who have a lot of excessive amount of bleeding. We can mix this herb with another herb called white witch hazel, and we can mix this herb with another herb called Tayachi ginseng, and some cinnamon, and some chickweed. And if you have bleeding any part of the body, if there's nosebleed, there is bleeding of the gums, there is bleeding in the rectum, there is bleeding in the vagina, this will help to stop the bleeding with other plants. This one is called St. John's wort, and a lot of people think that this herb is just only a depression herb. It is good for mild to moderate depression, but it's not good for what we call severe depression, only mild to moderate depression. But this herb have an oil called hyperacin oil that is good for people who have back pain and sciatic nerve troubles because it is also a nervine. It is also a herb we use for people who have herpes and HPV and megalovirus and hepatitis because it also have antiviral activity. All right, there's a lot of plants, man. This one is called rhubarb root, and this herb is significant for people who have mild to moderate constipation. Make you go to the bathroom, and if you're constipated or you have severe constipation, you can mix this herb with some cascara, some yellow root, and some dandelion root to help the liver to produce more bile so you can go to the bathroom properly. All right? Mugwort. This is another herb again for people who have trouble in the stomach, because tonight we're going to talk about ulcers. And this herb called mugwort is very significant for lots of people who have ulcers or digestive disturbances. Very significant for that. We can mix this herb with what we call angelica, another herb called fennel seed, and another herb called agrimony for people who have troubles in the digestive system. Okay? All right, we're going to talk about a couple more, and then we're going to go to the presentation. This herb is called hyssop. Cleanse me with hyssop so that it can be clean. It is in Psalm 51. This herb is very significant for children, and it is also important for colds and flus, but it has lots of antiviral activity. Hyssop does. And it cleans the lung, especially if you have lung cancer, and the cancer is in a lobe of the lung affecting the left or the right lobe. This herb is very significant if you can mix this herb with wild cherry bark. You know what I mean? It's very important for people who have lung cancer. But it is also good for herpes and hepatitis and cytomegalovirus and HPV virus, because it also have antiviral activity. Yeah? Don't forget the name. It's called hyssop. Go to the next one. Go to about two more. We'll start the program. This herb called nettle leaf. There is nettle leaf, there is nettle seed, and there is nettle root. And this herb is what we call a potassium-sparing diuretic, meaning that it can move the potassium out of the system if you have excessive amount of water or potassium or sodium, but it also is what we call a potassium-sparing diuretic, meaning that it makes you pass the water out from the kidney, but it makes you retain potassium because it have lots of potassium in this particular herb. So we call this herb a food herb for the kidney. Don't forget, nettle root, nettle leaf. It is a food herb for the kidney. Come there, the machine. Yeah. It's a food herb for the kidney because it feeds the kidney what the kidney needs. All right, it's called nettle leaf. Don't forget the names now. All right? Going to the next one now called linden flower. This one right there, linden flower. Linden flower is good for people who have high blood pressure and you have trouble in the heart especially, but it is also significant for people who have anxiety and depression. If you can mix it, because we call it an adaptogen, if you can mix this herb with ashwagandha and with Siberian ginseng if the person don't have energy, or you can mix it with an herb called Cassandra berry or rhodiola, or St. John's wort, and it helps with people who have mild to moderate depression or anxiety where they're having what we call panic attacks. Yeah, wonderful, man. Yeah, here we go. Next one. We go to the last one here now. This herb is called rose hips, and rose hips is full of vitamin C. So whenever you want to get vitamin C, drink a lot of rose hip tea, because rose hip is full of that. It's full of bioflavonoids. You know what I mean? It's full of carotenoids. It's full of terpenoids. It's good for people, women who have cancer. And if they're not taking tamoxifen, this herb called rose hips prevents the estrogen from invading the woman's receptors so that estrogen don't get in, causing the woman cancer to spread in the breast. Don't forget that now. Olive leaf, and next boss again, it's antiviral. It have antiviral activity, but it's good for high blood pressure. It's good for HPV. It's good for the COVID. it's good for hepatitis. It's good for any kind of virus, and it also helps to build the immune system too. Red root. Red root is a herb that works on the lymphatic system, and we know for a fact that your lymphatic system is vested in fluids that flow parallel to the bloodstream. So in order for us to have the fluids to become thin, we give you some red root, and it works well with cleavers and violet leaves and echinacea, and it helps the macrophages, which you house in your lymphatic system, to eat up all the bacteria that is causing you to get sick long term. But if the woman have breast cancer, and we want to prevent the cancer from getting from the breast, from the lobule of the breast into the lymphatic system, we go and we strengthen the lymphatic system with these herbs, preventing the cancer from getting from the breast into the lymphatic system, because once the cancer in the breast, it cannot harm you because the breast is not an organ. Collinsonia, It's called stone root. And this herb is good for what we call kidney stones, if they're not too big. But it is also significant for vascular integrity and circulation. So once you get this herb into your diet, it will help the veins to become strong. We call it vascular integrity. But it also works on removing kidney stone if mixed with another herb called gravel root. And if you get some magnesium, if the stone is coming from calcium crystals and oxalic acid, you can use this herb to remove the kidney stones from your kidney if the stones are not too big. Don't forget that, all right? We go to the program now. Woo! Yes, sir. Yeah. We'll give you real information about herb. This is how facts right here. You understand? Now, tonight I want to talk about ulcers, internal ulcers and external ulcers, because lots of people who have diabetes is losing the limbs, yeah, because of gangrene. And lots of people who have diabetes is losing their limbs because of ulcers, external ulcers. Lots of women and men who have sickle cell also slow to heal ulcers because they seem to get it too. Now I'm going to show you now how you can repair an internal ulcer and how you can repair what we call an external ulcer. The first thing you cannot do is to wrap that band around the ulcer. It's a waste of time, because remember that once you have an external ulcer on the hand, on the leg, it needs oxygen. Remember that your white blood cells, the immune system called the white blood cells, have to run to that area to help to heal that area if it's external ulcer, that is. Yeah. So what you have to do when you have an external ulcer, do not wrap the ulcer because it needs oxygen to heal. But you have to prepare the immune system to go in that area, and that particular area that the external ulcer is at, is what we have to produce what we call fibrins. So you must have, the body is white, you know, you must have the ulcer, the body producing or creating these fibrins like a gouge inside the ulcer, in order for the blood not to leak out. You see, because once the blood is leaking out of the external ulcer, because the fibrin is not formed properly, you'll never heal your ulcer. And that is the reason why lots of diabetics and lots of people who have sickle cell is not healing the ulcers, because they're not creating oxygen to the cells. Yeah? Tell you what to do. Come over here. So the external ulcers, we're gonna do anti-bacterial plants, and we're gonna do some oils and show you how the oils can go in and form the fibrins in the ulcer, and then they could heal the fibrin, put the hyperfibrin together, so that when you're going to fix the ulcer now, the fibrins are all sealed, and then you could get scabbing. Once you get scabbing now, and you see the area become red, not white, you know that the blood is moving properly because the fibrins are formed. All right, we're going to talk about them here. First one is golden seal. When you have an external ulcer, you must use golden seal because it is antibacterial, and it also have lots of berberine. So golden seal is significant if you want to fix external ulcer. Myrrh also is important when you have an external ulcer, because it have what we call an astringent plant like golden seal. So once you have an external ulcer, first thing you have to do is to put the golden seal powder and also the myrrh powder together. And what I do is I mix them with some magnesium powder, and then I make it into a little paste, and I put it on the external ulcer. And then what I do also is I take some vitamin E gel, and you take a pin and you prick the vitamin E gel, and then you squeeze the vitamin E gel in the external ulcer. What the vitamin E gel does, it go in and it creates oxygen inside that area. And then while you're doing the vitamin E gel, you're going to take some zinc, because zinc deals with wound healing. And the zinc also helps the fibrin to form because it works on the thymus gland that helps to increase your T lymphocytes, which will run to the area to heal a particular ulcer. You see? So the zinc is good for wound healing, but it also helps the fibrin to heal, to form, while the vitamin E now is, while you put in the vitamin E oil in the ulcer, external ulcer that is, you are now creating oxygen in there, and then the fibers start forming. When the fibers are formed, now you're going to see the area get red. When the area get red, not white, you know for a fact now that your blood is moving, and then you heal your ulcers, man. You understand? But what some people do? You go to the doctor with an ulcer, and you go to a nurse, and she bang it up. Doop, doop, doop. Yeah? And they may put some BNT powder, which is antibiotic. It's not bad. Yeah? But you live with that ulcer, with that bandage on that ulcer, for months and months and months. It don't get better. You see what I'm saying? Because your fibrin is not forming. Because they bang it up, no oxygen coming in. So what I say to people who have ulcers is, when you go home, take off your bandage, or you're going to get some bandage that have small holes in there. Yeah? So you put in the bandage that have the small holes, they call them gouge, and then right where the ulcer is at, you're going to put that bandage over the ulcer with holes in there, but you're not going to tape or put a cloth over the holes where the ulcer is at, but you're going to put that band on one side and put that band on the other side and leave the holes open so that oxygen could get into the ulcer and create the fibrin with the vitamin E, and you heal your ulcer in a week or two. Huh? That's external, right? Internal ulcers now. You can have what we call duodenum ulcers. You can have ulcers in the stomach. You can have ulcers in the large intestines too. Yeah? Why you have ulcers in your stomach? Because now you are too acidic in the stomach, and because the stomach produces mucus to protect the lining of your stomach from the acid that the stomach produces, sometimes there's too much acid in the stomach, and then the mucus cannot protect your lining. So it starts eating up the lining of the stomach walls. They call it an ulcer, or we call gastritis, or you get what we call GERD, or you get acid reflux because it's too much acid. The first thing you have to do is to drop the acid back down to the normal range. Upper stomach is 4.6, lower is 3.6. Don't forget that. They have to be in an acid state. But you have to now increase the amount of mucilage that the same stomach produces to prevent the same acid from eating up the lining of your stomach. Otherwise, you can get stomach cancer from that. Yeah? Now, how do we go in and repair internal ulcers? We don't go in like external, we go on a different level. We go to the what? Come over here, son. We go to the demulcent plants. Don't forget the word. Demulcent plants. Demulcent plants mean that they go in and they start soothing the ulcer internally. Yeah? And when they start soothing the ulcer, we now have to go to the tissues of the body internally now. Because once you're going to fix an ulcer, you have to use astringent plants and you have to use demulcent plants. Don't forget the words. Astringent and demulcent. Demulcent soothes the ulcer internally because it have mucilage. And over here, and the astringent plant soothe the tissues of the stomach area because they work together. And if there is any kind of if you have what we call nauseated feeling, or you have dysbiosis, we can add another herb called fennel seed as a carminative. So if there is troubles in the stomach lining and you have an ulcer there, we can use the demulcent plants. Marshmallow is one of them also. Slippery elm is one of them. And the astringent plant also. And then we can use what we call a carminative plant. Don't forget the names. Astringent, demulcent, and carminative. And what a carminative does, it calms the area. So while the carminative is calming the stomach area, these herbs now is going in and they're soothing your ulcers. And you're not eating no crackers. You're not eating no bread. You're not eating no meat, no flesh foods. Because now you're going to rest your stomach. And once you rest your stomach, now what you're going to feel in the stomach? Boom, over here. Boom. The best in all of them, the sea moss. Because the sea moss is a gel. And the sea moss goes in and it starts soothing the ulcer with all these herbs there. But it's much more effective than the slippery elm and the marshmallow because the sea moss have more mucilage and more minerals. You follow? And once you start soothing that area, you are not going to use the foods that is going to irritate your ulcer long term. So you are going to use carminatives. What is a carminative, Patrick? Chamomile is a carminative. What is a carminative, Patrick? Fennel seed is a carminative. Yeah? That's what you can use with these herbs. And then you rest your stomach. Once you're resting your stomach now, you are feeding your stomach what we call puri foods, where your stomach don't have to break them down into liquid, churning them like a machine, churning your clothes. And then you give it a break. You know what I mean? And after a week or two, the ulcer starts soothing because these herbs go in and start soothing the sore in your belly. It's a sore foot you have internally. Externally, it's a sore foot. Internally, it's a sore foot in your stomach too. Yeah? Now, if you have Crohn's disease, that's different. If you have mucus colitis, that's different. Because when you have Crohn's, go over there, son. So I could teach you all how to fix everything. You know what I mean? If you all follow that program properly. When you have Crohn's disease, now the Crohn's eat up everything here, all the lining. And that is the reason why Crohn's disease is so difficult to repair. Because it starts eating up all the lining of the intestines. And all because your pH in here changes from 7.5 to all 3.2, which is very acidic. And once your pH changes in here, all of a sudden, the acid that is created from bad eating habits and having food sitting in this area, it starts eating up the lining of the stomach, of the intestines, day by day. And you ain't no better. You keep on eating the same foods. And once he eat it up, he causes you to become malabsorbed. Because once you have Crohn's disease, you're going to lose weight. Because you cannot absorb anything in this organ. Because this organ also in the ileum is not 7.5. Because you're supposed to have a pH, potential hydrogen, of 7.5 in the small intestines, in the ileum. Because the ileum is 6.0, 6.5. But once the food gets into the small intestines via the duodenum, down in the pylorus, the pancreas have to send sodium bicarbonate in here. And when the sodium bicarbonate gets in the small intestine, it changes the pH from 6.5 to what? To 7.5, alkaline. So when the doctor tells you, the patient, that you have a duodenal ulcer, that means you've been eating so bad that all the food sticks in the duodenum and cause the duodenum pH down here to change into an acid terrain, all 5.0 for 4.5. And because now the pancreas isn't working properly, it can't send the sodium bicarbonate inside here. You start getting duodenum ulcers. You follow me? If you have too much acid in here, dropping under a certain number, and if you don't have the stomach working properly in releasing or producing mucus, the body must have mucus, don't forget that. All right? Everything is alkaline. The body must have mucus. The body produces mucus. The mucous membranes have it. You have it in your sinuses too. You have it in your lung. You have it all over the body. The mucous membranes. But because you are eating too much mucus-forming foods, you start getting excessive amount of mucus. Yeah? So when the stomach start producing the mucus to protect the same stomach lining from the same acid that the same stomach produces, you soothe it. So what we do is we just go in And we use herbs to help the stomach now to produce enough mucus, not excessive amount of mucus, enough mucus so that it can heal or protect the lining of the stomach walls. Because once you start vomiting and vomiting fat, that's mucus. You're vomiting. Dig that. Once you start vomiting fat, and it tastes bitter, that's your liver. Bitter vomit is your liver. There's bile from your liver. You understand? So you have to keep the pH in here, in the upper stomach, at 4.6 and the lower at 3.6. Don't forget that. Don't make them drop too much. You understand? And then you must keep the pH in here at 7.5 once the pancreas can send enough sodium bicarbonate in the small intestines, in the ileum, to prevent this organ here from giving you duodenal ulcers. Dig that. And this organ here, once you have food sitting for a long period of time, you're going to invite 1, ketol. You're going to invite 2, formaldehyde. You're going to invite 3, bacteria. And then all the bacteria sitting in there. That's why I said to people every day, you must do a yeast and a parasite cleanse every 3 months around the full moon to clean this out. And you're going to stay well. Can't get no cancer either. And then once you start to have food sitting in here for a long period of time, and all the good bacteria is now being overtaken by the bad guys you have sitting in there for a long period of time, a few things happen to you. Right over in this area here, the mucous membrane starts saying, hey, Negro, what's wrong with you? You are making me, the mucous membranes, send out excessive amount of mucus because I don't want you to send all your bad bacteria from your old food that you've been eating for years to come into me. Because once it comes into me, he can harm this organ. So I am going to, the mucous membrane is telling you that now, I am going to remove or send out excessive amount of mucus to trap your old goddamn bacteria. So this organ right here in the mucous membranes start removing, sending out mucus. Why, Patrick does? Because he's trying to protect you, the individual, bad bacteria, from entering inside the mucous membranes to kill you off long term. And he said, I'm going to send the mucus out there. So he sends lots of mucus out. That's good. What happened to you now? You start seeing mucus in your stool, and your doctor tell you, hey, son, you have mucus colitis. Dig that. That's where mucus colitis comes from. But in the medical system, they can't fix it. So they give you all kind of drugs, not knowing that once you have troubles in this area here, you can't use no tablet. This stomach right here, once you have troubles in the stomach with ulcers, once you have trouble in the stomach with acid reflux and GERD, you can't use no tablets. Don't use them. Because if you are not firing off of 6 cylinders, and if this little guy right here, which is like a fist, if he have to take your tablet and turn the tablet into a liquid, common sense now, how he gonna do that if he is not firing off the 6 cylinders? He's only firing off of 2. So there's no way you can feed him tablets. So what we do is, once you have an ulcer, we go in and we say, okay, we're going to give you some soups, some pumpkin soups, some blended soups, some puri foods, and we make him don't work. So when you eat and when you drink the soup and it goes down, he goes into the stomach, but he don't have to work no more. Because now you're resting him. And when you're resting him now, you are soothing your ulcers with astringent plants, with demulcent plants, and with carminative plants. That's what we call real herbal medicine. And you fix your ulcers. And you fix your Crohn's disease. Although Crohn's disease is hard to fix. And once you have, what do I hear? Once you get your intestine looking like that, you're dead. You're in trouble. Because what a man gonna do? Once you have an intestine looking like this over here, you know what a man gonna do? He gonna take it out. Especially if you have cancer in the rectum, in the anus down here. We call colorectal cancer. Once you have cancer in the rectum, forget about the sigmoid, in the rectum. He's going to take this out, this whole organ out. I'm telling you because they're trying to do to a patient of mine. Take it out. Although the cancer is small, they're going to take out this whole guy right here, and then they're going to drag this guy down into your anus. Huh? That's good medicine, right? Because they don't know how to fix it. So they move it out. So when you have Crohn's disease, you start eating up over here, eating up over there. And then all of a sudden, eat up the whole intestines. You lose a lot of weight, you get small, and you die because Crohn's disease can kill you, but mucus colitis can't. Colitis can't, and IBS can't if you know how to keep these guys over here healthy because they work together. Him, and him. They work together. If you have trouble in the pancreas, you're going to have trouble in your intestines. If you have trouble in the pancreas, you're going to have trouble in your stomach. If you have trouble in the pancreas, you're going to have trouble in the large intestines. If you have trouble in the stomach, you're going to have trouble in the pancreas. If you have trouble in the stomach, you're going to have trouble in the small intestines. And if you have trouble in the stomach, small intestines, you're going to have troubles in the large intestine. And if you have troubles in the sewage system, the garbage collector, the garbage collector is going to send all the garbage back into the walls and back into the hepatic flexure, and then you're going to get liver overload, acid, mucus, waste matter, excessive amount of minerals. That's not good. And then he's going to contaminate your gallbladder because he now cannot emulsify your fat with his bile salts, the liver that is, and then he's going to send all the waste into your gallbladder. And then the man going to come and tell you, hey, you got some gallstones. You have to take out your gallbladder because he don't know how to move to take out your gallstones, remove your gallstones. And once you have your gallbladder removed, you have your bile duct still there because you can get gallstones in your bile duct even though you don't have your gallbladder because the gallbladder and the pancreas share one duct. Take that. So he ain't fixing your troubles by removing your gallbladder. He making you carry no fats long term. Ah, boy. Yeah. This is the guy for ulcers. When you have ulcers, make sure you drink some sea moss tea. Mix with slippery M. Mix with marshmallow. Mix with fennel seed. Mix with chamomile. And you stay from heavy foods. And you will see that your gastritis, which can cause you to have cancer, get cancer, and the H. pylori bacteria, which can cause you also to get cancer. They'll be dead because once you have the H. pylori bacteria, you must use this guy. Once you have the H. pylori bacteria, you must use this guy. Once you have the H. pylori bacteria, you must crush up some garlic. Crush garlic up fine. Aged garlic. Fine. Crush them up. And mix the garlic with some honey. And you take a teaspoon every hour. Don't forget, mash up about 4 grains of garlic and mash it up very fine. You can put some almond milk yogurt, or you can put some honey and mix it together with the garlic, the 4 grains of garlic, mash it up, and you take a teaspoon every hour. And what the honey does, it carries the garlic into the stomach so it don't burn your mucus mucosa, because the honey acts as a lining protector while it is moving the garlic to kill the bacteria in your stomach. Take that, man. I tell all you, if what you do with things, you're getting better. So that's how we fix external ulcers for people who have sickle cell and diabetes and have neuropathy and have what we call gangrene, and they take off all your foot and all your hand or your toes or your knee or your eye. They take out your eye too, or your eye coming out. You understand? Don't take out all your eye or your foot because of gangrene. You could fix gangrene. We fix gangrene regularly. We remove people from a hospital in Grenada and fix the gangrene before they're gonna take off their foot. You know what I mean? Because the doctor do not have enough time to spend with you to fix your troubles. That's why you don't fix it. All right, good night. And the next program we're going to have before I leave to go to Grenada is going to be on Alzheimer's disease. And I'm going to show you, if you have an older parent, you have a mother or father who have Alzheimer's or dementia, I'm going to show you how you could fix them and get them memory to come back to normal. You're going to say, oh, God, Patrick Del, you're bad. Yeah, boy, you're bad. Yeah. God, where let's go. I will go back to the earth for my cures. You understand? Yeah? So we said today, I hear Mr. Biden say that famine is coming and food shortages is coming. So anybody who's a believer, I'm a believer. Don't forget, I'm a believer. Yeah? And I believe in scriptures. I believe in prophecies of scriptures. I believe. Yeah? So I go back in scriptures and say, if you're a believer now, Christ said, in the days of Noah, so shall it be in these days. We should be partying, winding up, carnival, jumping up and, oh, you know, kind of thing what you're doing, yeah. Giving in marriage, until the flood came and washed them all away. So prepare yourself, because I said sometime last year that we are going to have some form of food shortages, especially in the small countries in the Caribbean, because they are dependent on imported foods. So we have to get a little piece of land, and if you have a little house, plant your foods, because it's coming. And the same Christ come and tell them food shortages and famine in different places. Famine and food shortages has been nothing new under the sun, because everything that happening now been in scriptures. Man raping their daughter, man raping their sister, that have been in scriptures. Lot 2 children had sex with them and have children. Moab and Hittite, I believe. Yeah? Yeah? Joseph had to store up for 7 years of plenty and 7 years of famine. Yeah? So not every day is a good day. We're going to have good days and we're going to have bad days. You follow me? So prepare for the bad days. When the bad days come and you can't fast and your children start to cry, you understand? Then you're going to understand. Pile up your little food for now. Nobody's saying, oh, the UK have real food. The UK have real food? Just in the twinkling of an eye, boom, it could happen. Dig that, because God is great. And when he speaks and he says, God says that. He said, when I speak, whatever come out of my mouth will never ever come back to me unless it is fulfilled. Dig that, bro. And bro says, you got to come, man. Get all your food or get your home and fast. Whatever I speak, the Most High says, will never come back to me unless it is fulfilled. So keep on talking about God will protect us. God give us, he tell us, go and he warn us about the food shortage is going to come. So pile up. Don't come and say, but God will take care of us. God doesn't want to take care of nobody, he won't take care of himself. He gave us a warning. So heed to the warning. I mean, let's look at the numbers here, 437-290-3057-888-496-4770. Patrick Dells, Holistic Healing, HolisticHealing.com. And don't forget that I want to thank everybody for the support. You know what I mean? But we're getting there day by day. We might be slow now, but eventually we're gonna have to hire some more people, more black people, and we're gonna build up this little kingdom, and we're gonna have unity among ourselves. We're gonna show others how we as a people, black people, could live together and live as other so-called Jews living. In peace. Blessed love. 718-469-0985, Ambrosia Health Food Stores, 3306 Church Avenue. Plop. That's all right. Now, to come to Grenada now on the 4th, from the 4th of April, there's no vaccine. No PCR tests. So I'm going to be home in Grenada soon, after the 4th, because I ain't going to quarantine. I ain't taking no tests. So we're going to be in Grenada on the 4th or the 5th, because after the 4th, there is no vaccine to come to Grenada, and there's no PCR test. Don't forget that. So we're trying to build up that. We're trying to have that retreat in either May or June, and we're going to give you information. You could fly to Grenada. We're going to have a nice retreat. We're going to take you to the beach, to the mountains, and everything, and the waterfalls, and we'll have a good time. So we are now organizing that for Grenada in June or May, and in Jamaica in September, which is Ocho Rios. Wonderful.